Okay, hello everyone. Today we will discuss the MCQ question related to renal lithiasis, मतलब renal stone, and these all questions are related to NCLEX point of view. So let's discuss the question number 21. You can see on the screen. A client has a renal colic due to renal lithiasis. Which is the nurse priority in managing the care of the client? So you have four options. Just read the option and try to answer this question. Okay, so the right answer is administer an opioid analgesic as prescribed, because in renal colic pain it's a very severe pain. It may be 7 out of 10 and 9 out of 10. So we have to administer opioid analgesic to reduce the pain. So the next question is question number 22. A client is admitted to the hospital with a diagnosis of renal calculi, that is renal stone. The client is experiencing severe flank pain and nausea. Temperature is 100.6 Fahrenheit. Which of the following would be priority outcome for the client? Here are the four options. You can check the option and take the right answer. So in this case, answer number second will be the correct answer. The alleviation of pain, I mean answer number 3 is correct, because in the renal colic pain we have to reduce the pain. Reduction of pain is our first priority in the colic pain. Next question number 23. The client is scheduled to have kidney, ureter and bladder radiograph. To prepare the client for the procedure, the nurse should explain the client that. Four options are there. You have to choose one. You have 5 seconds. Try to answer this question. In this case, question answer number 4 is correct. No special preparation is required for the examination. In the radiography of the bladder, which we have to just normal, take it normal. We no need to prepare for anything. Now question number 24. In addition to nausea and severe flank pain, a female client with the renal calculi has a pain in the groin and bladder. The nurse should assess the client for the sign of what? Four options are there. Try to answer the question. The right answer will be referred pain, because there are severe flank pain related to renal calculi, means the stone pain is radiating to our back area. So this will be a referred pain. Now read the question number 25. Which of the following nursing intervention is likely to provide the most relief from the pain associated with renal colic? मतलब किडनी स्टोन के पेन को कौन सी नर्सिंग इंटरवेंशन से हम क्योर कर सकते हैं? आंसर नंबर 1, 2, 3, 4. Answer it fast. The question is very easy. The right answer will be answer number 2, administering morphine. In the previous question we discussed that the renal colic pain is very severe, so we have to administer morphine as an analgesic. Now read question number 26. A client who has been diagnosed with renal calculi reports that the pain is intermittent and less choking. Which of the following nursing action is more important at this time? Try to answer the question. Four options are there. You have just 5 seconds to answer. The right answer will be answer number 2. Strain the urine carefully. Means if someone has intermittent pain and less choky, that means the stone is flowing with the renal tract. It may come out with the urine itself. So we have to strain the urine carefully to see all the stones in the urine. Now let's discuss the question number 27. The client is scheduled for intravenous pyelogram IVP to determine the location of renal calculi. This procedure is used to determine the location of renal calculi or renal stone. Which of the following measure would be most important for the nurse in include for this preparation? Four options are there. Try to solve the answer. The right answer will be answer number 3, checking the client's history for allergy to iodine, because we use iodine in this procedure. If someone is allergic with iodine, we cannot do this procedure to the patient. It may be antibody antigenic reaction. Now question number 28 is on the screen. After the intravenous pyelogram IVP, the nurse should anticipate incorporating which of the following measure in the client plan of care? Four options are there. Try to answer this question in 5 seconds. Answer number 2 is the correct answer, encouraging adequate fluid intake. In the previous class also we have discussed that we have to maintain a good intake of fluids like 2 to 3 liters per day to maintain our kidney healthy. In case of IVP also we have to increase the fluid intake in the patient. Now read question number 29. The client has a ureteral catheter in place after the renal surgery. The priority nursing action of care for ureteral catheter is to. What will be the priority of nursing in this case? Try to solve the answer. Answer number 2 will be the correct answer. Ensure that catheter is draining freely. Why this is the right answer? If we are adjusting some catheter in the renal surgery, we have to make sure that the catheter is draining freely without any bleeding at that place. Now question number 30 on the screen. Which of the following intervention would be most appropriate for preventing the development of paralytic ileus in the client who has undergone renal surgery? अब पैरालिटिक इलियस क्या होता है? इसके अंदर हमारे इंटेस्टाइन की पैरास्टेसिस मूवमेंट वीक हो जाती है या कम हो जाती है, तो इस चीज़ को प्रिवेंट करने के लिए हम क्या एक्शन ले सकते हैं? ट्राई टू सॉल्व दिस क्वेश्चन इन 5 seconds. The correct answer will be answer number 1. Encourage the client to ambulate 2 to 4 hours daily. It means when we ambulate, when we do some exercise, it will improve our parastasis movement. Now let's discuss the question number 31. The nurse is conducting a post-operative assessment of the client on the first day after the surgery. Which of the following would be most important for the nurse to report the physician? You have 4 options. Try to solve this question. The right answer will be answer number 2. Urine output 20 ml per hour. It is reduced. The normal urine output must be minimum at least 30 ml per hour. When the urine output is low as 20 ml per hour, we have to report the physician in this case. Now let's discuss the question number 32. A client with a history of renal calculi formation is being discharged after the surgery to remove the calculus. Which instruction should the nurse include in client's discharge teaching plan? So this is very important because in the discharge we have to teach the client how to care at home. So what will be the right answer? The right answer will be answer number 1. Increase daily fluid intake to at least 2 to 3 liters. Now question number 33 is on the screen. Because a client's kidney stone was found to be composed of uric acid, low purine and alkaline ash diet was prescribed to the patient. Incorporation of the which of the following food item in the home diet indicate the patient understanding the necessary diet modification? Because a patient has a kidney stone which is made up of uric acid, so we have to provide some diet medication modification to the patient. So what will be the right answer in this case? You have 4 options. Try to solve this answer. Option number 1 is correct. Milk, apple, tomatoes and corn, because they are low in purine, so we can educate the patient to eat apples, tomato, corn and intake of milk. Now let's discuss the question number 34. Allopurinol 200 mg per day is prescribed for the client with the renal calculi to take it at home. The nurse should teach the client about which of the following adverse effect of the medication. So what do you think? What will be the adverse effect of allopurinol? We have to teach the client about adverse effect of any drug when they are taking this drug at home. So the right answer will be answer number 2, that is maculopapular rash. So these are the adverse effect of allopurinol drug. Now the question number 35 is on the screen. A client has been prescribed allopurinol for the renal calculi that are caused by high uric acid levels. Which of the following indicate the client is experiencing adverse effect of this drug? So, in the previous question we have discussed the rash is the adverse effect of this drug. What else are the adverse effect of this drug? Are nausea, rash and bone marrow depression. So answer number 1, 2 and 5 will be the correct answer. So now question number 36 is on the screen. The nurse is reviewing laboratory reports for the client who is taking allopurinol. Which of the following indicate the drug has a therapeutic effect? So the right answer will be answer number 4, because kidney stones, renal calculi are caused by increased uric acid. So this drug will decrease the uric acid level, so it indicates it has a good therapeutic effect. So this is all about today. Now in the last class we will discuss more questions related to renal disease. विशाली मैम एक बार आना. 36 के बाद ये क्वेश्चन 19.